I'm going to try. Right, folks. We have 3 motions here. For my part, I would like to try, I know we stop at 6, but I would prefer we push through. But are we all okay with it? We try and get this concluded today. Okay. So, Councillor McNeilis.
Garmega, and I'll take the motion as read. So within our council area, we have 4 Gaelscoilna, 3 in Derry and 1 in Strabane. Each school has a unique ethos and sits within an area where there is need and a demand for Irish medium education. Year in, year out, the numbers of parents who become interested in gifting their child with bilingualism through education is growing. These parents aren't put off by the lack of modern facilities, but rather are inspired by the advantages of bilingualism. Now, when I say lack of modern facilities, I'm not talking about an old school building in need of repairs caused by time. I'm talking about porta cabins with patchwork repairs, which are no longer fit for purpose. Repairs that are resulting in soaring maintenance bills, and where the maintenance teams are there that often that they may as well as roll as pupils, and that's to be really honest. Porta cabins that mean children are exposed to all of the elements of bad weather days when they need to go from A to B to use the bathroom or go for lunch. As I've said, despite this, the pupil numbers are growing, and this highlights the urgency for the Education Minister to sign off business cases and to commit a timescale on capital works for Bunskull Colmkill and Gaelscoil na Daraga, and to add haste and a timescale to the site search for Gaelscoil Edenmore. We look to our cards in Strabane, who are nearing the end of their purpose-built school journey with Gaelscoil Gahary, and we congratulate and look up to them as we urge the Education Minister to set the Gaelscoilna in Derry on a par with them. No child should have to settle for a lower standard of facilities because they attend an Irish language school. No parent should have to miss watching their children at their school shows because there isn't enough room in the halls. Now, my child or any of the other children that attend these schools have no idea of the stark disparity that exists, but I know, and we know, and the Education Minister knows, so I am accountable, we are accountable, and our Education Minister is accountable. The Irish language community in this city and district is thriving, and the children are excelling both in curricular and extracurricular activities, and we are now at a stage 40 years down the line where enough is enough, and there is no reason why my child shouldn't have access to the same facilities as the next. Garmega.
And just for clarity, Emma, you second that motion, yeah. Any speakers? Catherine?
Thank you, Mayor, and thank you to Councillor Needis for bringing the motion. We within the SLP welcome it. I'm very glad to see it come before Council. The ever-growing interest and passion for education through the Irish language means that all 3 schools mentioned are outgrowing demand each year. The growing demand shows not just the renewed interest in our native language and culture, but it also reflects the high quality of teaching in these schools. The days of learning Irish in the bushes and behind closed doors are long gone, and now we need the days of the Irish schools being restricted to cold cabins and leaking huts to be consigned to the past as well. I've been working closely with the Bunskull Colmkill, and I was really shocked to learn that the porta cabins in the school have been there since the school opened 40 years ago. There are huts that are being patched up with walls mended and boilers fixed, but no long-term solutions. I just don't know how this is cost effective. They don't have a hall for PE or assemblies, and they have to eat their lunch in the school down the road. So they have 4-year-old children are walking outside in rain, hail or snow down the road and to another school to eat their lunch and eat their dinner. At the very least, students at this school deserve a designated space to enjoy their lunch and do sports. I was glad to see the Education Minister has accepted Colm Eastwood's invitation to visit the school and that there's a date in the diary for May. And I'm hopeful that when Mr Gibbons sees the outstanding level of teaching taking place in an environment that's crying out for upgrades and modernisation, he'll sign off these business cases, and I'm sure the Finance Minister will have ensured the money is required for them to be taken forward as there. The problem in many schools, not just in the Irish medium schools, is that they have been denied adequate funding year after year. This has been going on long enough. It needs to stop, and we need ministers to put their money where their mouth is and ensure that all our children get the education they deserve in a warm, safe environment that's conducive to learning. So thank you again to Councillor Needis for bringing this motion, and we join her in the call for the Minister for Education to sign off these outstanding business cases and look forward to them moving forward with adequate funding provided by the Minister of Finance. Thank you.
Okay, I can't see any other Councillor Harkin.
Thank you, Mayor, and thank you, Councillor Neelis, for bringing the proposal. And People Before Profit are happy to fully support it. I think that Councillor Neelis is right. The Irish language is thriving across the north, and we want to allow it to thrive even more. And I think that means that the Gael schools have to have the proper infrastructure. One of my children is already attending a Gael school, and it gives me an enormous amount of pleasure every day to see to have him in the house now, speaking Irish, telling me new words in Irish, new things in Irish, learning political chants in Irish, and it's just brilliant. And I'm very proud that that's happening. But I think that it's been decades long. The underfunding has been decades long to our Irish schools, and I think that this is an opportunity now with the restored Stormont to address it. So I think that our council, back in our Gael schools, back in our Irish language education sector, and back in the families and the students that are at those schools is very, very important. So I think that this is a great motion, and I think that the schools will very much appreciate it.
Alderman McMorris.
Thank you, Mayor. I'm just going to keep this very brief. We're happy to support the motion. Just we wanted to highlight the fact that there's other schools who are also in the same position. I can name one that's about the balls and everything's about to fall down. Ashley out in Tullyally is in a terrible state of repair. So we're happy for the motion to go on, but we just recognise that there's other schools also needs repairs.
Councillor Donnelly.
Gormagat Chair and Gormagat Grace for bringing this. As a parent of a child who was educated at Bunscoil Colmkill, and no, it's been outlined by Councillor McDade and by yourself, Councillor Neelis. I'm not going to go into that, but every child should have a proper standard of education, whether it's in Groarty, the Fountain, Holy Child's, or Irish language schools. I think it's important that we do whatever we can to ensure that these children are getting a proper education and in proper surroundings. So very happy to support the motion. Thank you.
Okay, I see no dissenting voices, so we're all in agreement with this. Yes. Thank you. On now to Paul, Councillor Boggs.
Margaret, Avira, and can I take the motion as read, please? Okay, yep. Thank you very much, Mayor. And I think all of us in this chamber will recognise the importance that play has, particularly for early childhood development and how it aids social interaction and also inclusion amongst our children. And we obviously have the plan, which was developed before I came into council, but having looked at it, I think we can all recognise that there are play parks right across the Southend district that are in dire need of repair, particularly those that are flagged as red on the amber kind of chart. But I think while we lost out on the levelling up fund, if we don't find and I know officers are working, and it's not a criticism of officers, I know they are working to try and explore every opportunity that is available to try and fund the play strategy. But I think if we don't move quickly and we don't try absolutely every avenue, then we're going to end up with ambers and reds and greens and amber, and we're never going to get to the root of the problem. I think every councillor on here will recognise that there are dilapidated play parks that need attention. There are ones then that maybe need a bit of attention but can wait. There are ones that are in okay condition. But we also have black spots as our towns and our city and the district has grown. We now have black spots where play provision is not provided. I think of areas in my own town, and I don't want to get DEA specific because I think the play plan speaks for itself. But on the Derry Road and out in the Ernie side of Strabane, where there is no play provision, and it's not good enough. But how can we build more play provision when we can't even fund a strategy to fix what we do already have? So I don't want to labour the points too much, but I think we just need to explore every opportunity. And as stated in the motion, there is an element under the inclusion action plan within the Department for Communities where the Minister could provide funding if he looked favourably at the strategies that we have done. I think we have done a lot of the groundwork for the department in terms of highlighting and looking and spending a significant amount of money on the play plan. And it is, you know, it has been designed in collaboration with children, with parents, with council itself. And I think that's the plan forward. So I don't want to pick it apart and vouch for different play parks within my own DA, although I could, and I could name you 5 off the top of my head. But I think we need to move to a position where we are funding the strategy as a whole, and that we work together on it. And it isn't about political ones or small ones for local areas, but that we look favourably at our whole entire play plan and ask the Minister to do likewise. Skurmugget.
Thank you. And before opening up to the floor, just want to apologise to Grace. I didn't give her the opportunity to sum up, so apologies for that. I know you're all right with it, but again, I'm sorry.
Get you in the long grass.
So, Councillor Barr.
Thank you very much, Mayor, and thanks to Councillor Boggs for raising this. Ensuring that our children have access to adequate and suitable play parks is a fundamental aspect of building a vibrant and healthy communities throughout this council district. For example, when we see that only one play park is meeting the high mark in Strabane Town, while others fall short, it highlights a significant issue that needs attention. By investing in well-designed, inclusive play areas, we are not just providing entertainment for children, but we are also fostering their physical health, cognitive development, and social skills. Play parks are not fit for purpose. Play parks that are not fit for purpose can limit children's opportunities for active play, exploration, and interaction with their peers, and this can have a long-term effect on their overall well-being. Improving play provision in our council areas from Strabane Town to Derry City, Sperrin to the Mirror, Derg to Ballyarnett, Foyleside to the Fawn, and then onto the waterside, and of course the rural areas of the Sperrin and Derg DAs where play provision is, in most cases, is non-existent. Each DAs all have their own individual issue, and each are important areas of need across our council district and would be a step towards creating a more inclusive and supportive environment for families. It's about creating spaces that encourage creativity, physical activity, and a sense of community. So advocating for better play areas is not just about fun, it's about investing in the future of our children and promoting a healthier, happier society for everyone. So I'm more than happy, we in the SDLP are more than happy to support Councillor Boggs' motion and especially to put pressure on the Minister to deliver for all our children across Derry City and Strabane District Council. Thank you.
Thank you. Alderman Middleton.
Thank you, Mayor, for letting me in. And on behalf of the DUP team, we welcome the motion and are confident that our Communities Minister, Mr Gordon Lyons, MLA, will be in support of our council's plans to deliver first-class play provision. The DUP's most recent manifesto talks of the need to increase play facilities and access for the disabled, and therefore as a party we have pledged to continue to work to improve play facilities that are truly accessible to all. As a mother and someone who works in the learning disability field, I am acutely aware of the need for inclusive play for the many reasons, from educational to social to mental health. Play is so important, and it's important for all our children across all our communities, and we will, as a party, work to support council and the department as needed. And just to mention that whilst we welcome the design and consultation, there are areas such as Rostowney, just to name but one, that has currently no play provision at all, and those children matter like as much as any other child across the whole district. But to conclude, we will definitely be supporting the motion. Thank you.
Alderman Hussey.
Thank you, Mayor, and thank you to Councillor Boggs for bringing the motion. Members in the chamber will know that not alone just in this remit of council, but in the previous one, this has been something that has concerned me for some time. It's been rightly pointed out by Councillor Barr that there are certain areas that there are more red marked play areas than others, none more so than my own in the Derg, but we're not being specific here. We're talking in terms of all. We're talking on all of those play parks which are substandard. It has been identified, as has been rightly said, by council and by that particular investigation that has led to the proposed strategy. I have urged that we should have this as an item brought into our overall capital expenditure of council, but of course, to have the potential of additional financial assistance via the minister would be a great advantage to that, and assist all of the ratepayers of this area, but more particularly assist those children who do not have access to proper play facilities in their own areas. Not to mention those areas, as Councillor Barr has pointed out, an area, Strabane Town, which actually lies in the Derg area, on the other side, in the Ernie Road side of the bypass, no play facilities at all. So to address all of that will take a commitment from the Assembly to assist Council to do that. And I further welcome the commitment that we have from the party of the Minister that this is something that he will look at. And I await the results of that. Thank you. Mayor.
Okay. Alderman Kerrigan.
Very briefly, Mayor, as my colleague Alderman Middleton has spoken on the motion, I'm in two minds, but I don't want to prolong the whole thing. You know, the last two play parks that were put within their own DEA were funded by DERA. You know, and I don't, there's potentially there, you know, the DERA covers the rural community. I mean, the one in Sion Mills and the one in Newton Stewart were both funded by DERA. So I would have thought that, you know, no problem with the motion as it stands, putting funding to the letter to the Minister of Communities, but I do no harm in including the Minister for DERA. And if we're content, I can put forward that as a proposal, just as an amendment, to just include Minister for Communities and Minister for DERA in that regard. And as I say, Alderman Hussey has touched on the play plan. We're not going to be specific, but we have areas with no play park and areas with play parks locked up for years and different bits and pieces, but that's for another day, and we've given her rehearsed it before. But if that's in order, just an amendment to Minister for Communities and Minister for DERA.
Have you a seconder for that, Alderman? Thank you. So, Councillor Harkin.
Thanks, Mayor. Yeah, happy to support the proposal. I think play park provision is, you know, something that needs to be urgently addressed. I think there's a lot of play parks that need upgraded. There's a lot of areas that need play parks. And if that's going to happen, it's going to need to be funded, and that means it's going to need to be prioritised. So happy to support the motion. I think that there's a bit of a pattern here in terms of the ministers that are being targeted in these motions. And I think that the right minister is being called upon here, but I also think if there's other ministers that have this is an area of responsibility, we should also be calling on them. A lot of these are cross-cutting issues. And look, if the minister doesn't deliver on this, I don't see it as the failure of one minister. I mean, this is really going to be about the failure of Stormont to deliver proper play park provision in our council area and across the north, and that because that has to be financed. So there's a lot of great demands here in these motions, and I think it's going to take a lot of campaigning and pushing of individual ministers, but also of the entire executive to make it happen.
We have a very short amendment.
Can I just have a point of clarity on the amendment? I absolutely 100% support it, but just because later on in the motion it talks about writing to the Minister of Communities, in particular in relation to his Equality Action Plan, would it be from a council perspective then that we send a letter to the Communities Minister based on what is already on the motion, and then one to the DERA Minister in terms of rural need, rather than, because obviously you send to the DERA Minister about his Equality Action Plan, he's going to say, I don't have one. Well, I do have one, but I don't have one that talks about play parks. So I'm just asking from an officer perspective how we will work that out. Thank you.
Just got clarity. That letter will be written accordingly. Is that okay? So I take it that everybody is in favour of the amendment. Yeah. And then everybody is in favour of the substantive motion. Yes. And I'm going to give Paul now the opportunity.
Very briefly, absolutely no issue with the amendment, and actually welcome that we call on on any minister. I'm not particularly precious where the money comes from. I would just like to see the money coming and start to fund the play plan. And in that regard, I can assure Councillor Harkin that it was not directed at any one minister for any political reason or because they are the minister or what party they come from. It is purely in order to get the play plan funded. And I'm glad that it has got support today. So I'll leave it at that, Mayor.
Okay, I'm going to pass it over now to Councillor Hutton.
Thank you, Mayor, and I'll take the motion as read as well. Christopher. I suppose this motion is to talk about something that is probably really hard for some people to talk about or even face, but cancer is a disease that is affecting a lot of people here in our district, as well as throughout the region here in the north. And it is also to commend the exemplary work that has been done and is being done at the Northwest Cancer Centre, as well as all our community services like Hive Cancer Support, the Foyle Hospice, Macmillan. So it's just to commend the work that's been going on in both primary and community care. What is concerning at the minute is that the types of cancer are changing, probably due to like changes in our environment, people's lifestyles. And it has also been noted this week that cancer is affecting more people in the age group of 18 to 49. So cancers in this age category have risen by 20% in the last 25 years. So I think that it's important that we can do better for all ages, including children, teens and young adults. Prevention and early detection are key to reducing the disease burden and improving cancer outcomes. We should be creating treatment pathways that will deal with early onset cancers, as this will allow for support to be scaffolded around patients and indeed their families as well. I think that there are brilliant cancer services out there, as I have mentioned, across primary, secondary and community care. But by implementing the cancer strategy here in the north and indeed working with our cross-border colleagues, we will have the opportunity at each stage of the patient journey to contribute to more effective treatments, a better quality of life, living beyond cancer, or a meaningful palliative care. So I think it's really important that we write to the Health Minister in relation to getting an update as to where the strategy is at the minute, because through the collaborative working and through councils requesting this, I feel that we will make meaningful change that in turn will help people that are out there facing cancer diagnosis, taking them through their journey, and it'll also support the collaborative working that's going on in our communities at the minute and the action that's being taken to work cross-border to support them. Thank you.
Thank you, Alderman Cook.
Thanks, Mayor, for letting me in, and thanks to Councillor Hutton as well for bringing this motion forward. So this is a topic, and it's something that's close and has touched many people, and I'm even sure here in the chamber today, myself included. And personally, I can share with you all that there's nothing more profound than hearing the word cancer, especially when it involves someone you know, your nearest and dearest, or even yourself. After reading this month's motions, I did some research, and some of the findings were absolutely shocking. The number of cancer cases diagnosed in Northern Ireland has increased by 54% over the past 25 years and is projected to double by 2040. Although waiting times are nowhere near where everyone wants or needs them to be, I would like to highlight that going by the Department of Health statistics from July to September of last year, that 87% of patients diagnosed with cancer received their first treatment within 31 days, and the Western Health and Social Care Trust was the only trust to meet their target. So just wanted to highlight and a well done to them. There is a real need to move forward urgently to implement the actions outlined in the strategy and to rebuild and transform our services in the short, medium and longer term. My party colleagues and I fully support this motion, and thanks again to Catherine Hutton for bringing this motion forward. So thank you, not Catherine Hutton, Ashley Hutton. Sorry, thank you.
She's probably Councillor Tierney.
Mayor, thank you, and thank you to Councillor Hutton for bringing this motion. I think it's one that everybody should definitely be supporting. Absolutely. I think the Northwest Cancer Centre is the best example that we have across this island of North-South partnership, and the effectiveness that that has to deliver for people is by far, in my opinion, the best example that we have anywhere. And I would like to see the example of the Northwest Cancer Centre being rolled out a lot more across society and across every aspect of public life, from tourism, business, everything. And it would make those of us who want to see a united and New Ireland, it would make that argument a lot easier, not to take away from the cancer strategy or all of that. Very important stuff that's in it, but I just think that for our aspirations of where we want to go, this joint up approach and showing that we can work together is absolutely something that we should be advertising and advocating. In relation to the cancer strategy and trying to get that rolled out, it is key that that is done. Thankfully, I haven't had anyone immediately close to me who has been diagnosed with cancer. And I'm one very lucky person to be in that position, but I can understand and I suppose feel the anxiety of people who have. And I think that that's what we need to try and address here today. The target for a red flag referral to begin treatment is 62 days. And those 62 days must be absolutely horrendous for people. And we have to do all we can to support people. I know of one gentleman who was diagnosed with cancer in August and didn't receive his first batch of treatment until the week of Christmas. That's nearly double, over double actually, the targeted waiting time. And it's not down to the staff at the cancer centre or the healthcare professionals who are working really, really hard to try and treat people and do the best they can. It's down to the strategy, and it's down to how we can try to drive down waiting lists across the entire health service, but particularly here. I think it is something that we should be doing. It's something that we should be pushing. And now that we have the Restored Assembly and we have a health minister in place, it is definitely something that we should be trying to drive forward. But I think we have to recognise the ongoing work that's going on within the Northwest Cancer Centre, but as Councillor Hutton touched on, also within the community as well, to support people, support patients and support their families as they're going through this journey, because I think that's very, very important as well. And I think we should acknowledge that, and I know Councillor Hutton obviously did, but it's just something that I want to be associated with as well. And I think we also have to acknowledge the battle, and I can't find any other word for it, the battle of the staff within the cancer centre. I know a few nurses who work there, and I know how run down they are and how under pressure they are. And with the delivery of this strategy, which support them nurses as well. And I think, absolutely think it's something that we should be trying to drive forward and get that cancer strategy delivered upon. And we are, within the SDLP, are only too happy to support this particular notice of motion. Thank you.
Councillor Harkin.
Thanks, Mayor. Yeah, and thanks to Councillor Hutton for bringing in, for putting forward this motion today. And I agree with Councillor Hutton that we need to commend the staff at the Northwest Cancer Treatment Centre. I think they do brilliant work and life-saving work. And I think that, you know, when you hear from people about their treatment there, people are very, very, very positive. But despite the you know, magnificent efforts of the staff there, I mean, our cancer waiting time, our cancer treatment waiting times are shameful, and you know, I think it is just shocking for us. So I do think again that Stormont being back is an opportunity to put a focus on addressing this. I think the fact that this is the Northwest Cancer Treatment Centre is an example of North-South coordination. I think does speak to the fact that I think that, and many others agree, that an all-Ireland health service is the way forward. It's not about, like, you know, constitutional jurisdictions. It's about how do we actually fix people, how do we save lives, and this is a very good example of that. And I think that most people, from a practical point of view, you know, want to see if this works. If this provides more funding, if this is a way to get more people treatment, if this is a way to get cancer waiting times reduced, you know, that's the way forward. And if it applies here, it can apply to so many other things as well. So I think that the message from the council that we want action in this is a very important one. So we're happy to support the motion.
Councillor McDade.
Thank you, Mayor, and thanks to Councillor Hutton for bringing the motion. I just wanted to very briefly say just that the North West Cancer Centre, how important it is. My daddy was diagnosed with cancer less than 10 years ago, and he had to traipse up and down that Glen chain at least once a week and then eventually 5 days a week. And the toll that that took on him, on my mommy, bringing him up, and us as a family was just as bad as the cancer diagnosis. And then in the past 2 years, I've had 2 best friends and another immediate family member all diagnosed with cancer, and they're all getting treated in Derry. So the difference that makes, not just to the person, but to the family, to the young children, to the partners, to the friends, it's massive. So although we're calling on the cancer strategy, there's massive improvements have been made in the past 9 years, and I can speak personally for that. So I just wanted to just recognise it and thank them. Thank you.
Councillor Donnelly.
Good Chair, look, I'm going to keep it short and brief too, but I'd like to thank Councillor Hutton for bringing this motion here today. I don't disagree with anything that has been said. I think it's also we can mention that you know, the people who have survived cancer and what they have been through, and you know, whatever resources there, they battle this horrible disease, where it's north, south, east, west. It should be used and utilised in order to prevent it or, you know, recover from it. So again, I'd like to thank Councillor Hutton, because it's an issue that hasn't, you know, you're very, very lucky if you've escaped without having a family member or a relative that hasn't been killed or injured from this disease. So again, thanks, Councillor Hutton.
Alderman Hussey.
Thank you, Mayor. I want to propose an amendment, and it's in the vein of the previous motion, to recognise that this is more than just one minister's responsibility, because at the end of the day, let's not forget, the minister needs the resources to be able to fulfil what he wishes to do. And in that, the amendment has been passed on, I believe, and it's just to add that right to both the Minister of Health and the Minister of Finance, if that can be inserted, and I can then speak to the amendment if it's seconded.
Can I have a seconder for that amendment, please? Thank you.
Go ahead, Mayor. Thank you. I well remember the kernel of the idea of the Northwest Cancer Treatment Unit came from the former Minister Michael McGimpsey. I was about at that time, and it was a tremendous idea that came from the Minister and was initially developed by that Minister and was followed through by others. We all know that cancer is a cruel disease that sadly very few families can escape. And previous speaker has outlined it's not just the particular patient who is diagnosed, it's the entire family circle and their friends that this can impact on. Far too many people are being forced to wait, and that waiting period impacts again on that total swathe of folk associated with the patient. They wait far too long for diagnosis and treatment. They face treatment they face that due to the pressures that face cancer services across Northern Ireland. And that's not a criticism of staff. It's already been pointed out. I think Councillor Turney emphasised there. Staff are working their hardest to deliver all that they can, but the fact that the politics of this place has robbed both patients and staff of planning and budgetary certainty that they require. Cancer is a disease that doesn't wait. Instead, it often thrives in any periods of delayed intervention. Cancer services are already facing a precarious position following the last collapse of the executive and the failure to put in place a multi-year funding plan. It was always going to be inevitable that despite the best efforts of the clinicians, the situation overall was going to get worse. Yet just before the last collapse, the Minister of Health set out a clear pathway within the 10-year cancer strategy for ultimately ensuring that everyone in Northern Ireland, wherever they live, has equitable and timely access to the most effective diagnosis, treatment, and person-centred cancer care. Since that time, despite all political parties initially agreeing to fund the hugely ambitious plan, instead of seeing the start of widespread improvements, patients have been failed as the plan has been starved of the political leadership and budgetary commitments that is required. The recent restoration of our Assembly and Executive, we can once again have an opportunity to properly support and improve our cancer services, just as the 10-year strategy set out previously. But to do that, we need both political leadership and finance. So it's time the Executive put its money where its mouth is. The cancer strategy will not only achieve all that has been set out, if the necessary funding is allocated to the department, and ultimately, the only person in Northern Ireland who can ensure that that isn't actually the Health Minister, but Minister of Finance, who hopefully can work with the Health Minister to ensure that the strategy can be enacted. As has been rightly said, and I know that some in the chamber know my own circumstances, to get that diagnosis is particularly, it slaps you back, and it slaps all around you back, and the waiting time is the big issue. Happy to support hopefully the amendment and eventually then the motion when it comes to the floor. Thank you, Mayor.
Folks, I have no other indicated speakers, so we have an amendment on the floor. From what I'm hearing, there doesn't seem to be any dissenting voices, so I'll take that we're all in agreement. I'm now going to go to the substantive motion, and I take it that's the same. So, Aisling, do you want to sum up?
Thanks very much, everybody, for your support. And I do support the amendment as well, because as we all know, any strategy that central government are looking to implement, it costs money. So thanks to Alderman Hussey for that. And it's just to say as well that we as people of this district should be very proud of the lobbying that took place and the people in this area that made this happen. For instance, the Pink Ladies, who are now Hive Cancer Support, and Martin McGuinness, they worked really hard for the centre to be opened, and it did open in 2016. And since that date, there has been cross-border working, the sharing of resources, and most importantly, shared learning about how this disease can be tackled, both working with researchers and working in-house as well. So I'm really happy that everybody has supported this today. And I'm hoping that we get a good response from the Health Minister and the Minister of Finance as well, and that this strategy can be prioritised so that we can continue and to support people who are going through the illness, and also support their families, because when this comes into a family, it just rips through the fibres of it, and there is a holistic approach to dealing with it, to eliminate and minimise trauma. So thanks again, everybody, for your support.
Thank you. So, members, that's the end of the motion. So were the other matters 16, 17 and 18 are for information. Has anybody no comments or questions? Okay. So there's nothing left for me to do but other than wish you all a very happy Easter, and I hope you all get a wee rest over the next couple of days. Okay, thank you. Thank you.